Welcome to a new episode of the Life Science Get Together podcast. Today, I have the honor and pleasure to talk with a well-known business angel, investor, and serial entrepreneur from Denmark, Nicolaj Nielsen. Welcome to the show.
Thank you.
Nicolaj, how did you become a business angel and a serial entrepreneur since 1999? What has driven you?
I think in many ways it's a classic journey I've been on, where I took my master degree in the 90s, and at that point in time, you were sort of at business schools, you're sort of brainwashed to believe you should be a CEO in a big company, right? Mm-hmm. So I basically spent the first 5-6 years in large organizations, where I gradually realized what I've sort of always known, that I want to create my own companies, because I created my own companies since when I was a student, even before, sold illegal computer games and stuff like that. But you sort of come into this mode where you think that you need more savings, you need more experience, and then in 10 years, I want to be an entrepreneur. But then when you realize that after the honeymoon days in a new company, that it's not really what you want, then I sort of realized when I was around 30 that I have to do it full time. So I basically quit my job in a pharma company in 2007. And I didn't really, I spent all my money basically on my MBA. So what I did was to start doing consulting. And since I worked in the pharma industry before, I basically did consulting there, not with the goal of creating a consulting company, but with the goal of finding out what I want to do. And you can say that was sort of my life the first 2 or 3 years. And then gradually via my network, I was involved in some startups where I could use some of my consulting money to invest a little bit. And then I become co-founder of several companies. And that I did, you can say, from 2008 to 2015, where my main job was to become co-founder of startups, where I was paid a little bit of money, but majority in equity. And then I was so lucky in 2015 that my first investment was sold to Intel, and I got some money out, and then I decided, well, what is it really what I want to do? I already knew I didn't want to work in a big company, but should I become an operational CEO or should I become an investor? And I went for investor because I think that's what I like the most and where I can do my most for the company. So you can say different stages, 2000 to 2006-7, thought I should be a CEO, 2007 to 15, sort of creating my own companies, and we're lucky there. And then the last 5 years, full-time, you can say business angel. That's so.
It reminds me of my own life. I studied in the 90s in Austria, and these were those crazy days when the internet was young. And I completely can agree to the picture you painted, that you say, I mean, at the university, what was I trained into? It was find a job in a big company, work up the career ladder, and be happy with that. But it has a little bit changed luckily in the last 20 years. So the ecosystem has evolved, and more people are moving towards the entrepreneurship space. I had last year the opportunity to speak at conferences in the United States with US-based investors, and they always point a little bit out Europe. Yeah, it's an interesting space, it's nice technology, but the ecosystem isn't really there. How did you experience in the last years the ecosystem?
I think just the sun shining, talking about working from home. How has it changed? I think if you go back 20 years, there was basically no ecosystem in Europe, like basically nothing, right? Of course, there was startups, but there was no VCs. There was only a handful of VCs. They were typically relatively inexperienced. They were typically sort of ex-bankers, and everything happened in Silicon Valley, you can say, right? It was really the center of the universe there, at least and there was no one in Europe. And I think what have happened over the last 20 years is a lot where you have real ecosystems in Europe. I think it really started, for instance, in London, where you can also see the amount of venture capital going in there, has been really, really big and a real ecosystem, but also spreading out. You can say a lot of things are happening in France. A lot of things are happening in Scandinavia, also especially Sweden. And it's typically been driven by, at least how I see it, right, by some successful entrepreneurs and VCs who get more confidence, got more money, and therefore putting money into new startups. And you have entrepreneurs who are not first-time entrepreneurs, but who have done it before. And we all know the difference between starting your first company and starting the second company. There's just so massive difference. So what I've seen is now that over the last 10 years especially, you really have strong local ecosystem. Of course, each of them in Europe are much smaller than US, right? Mm-hmm. They are smaller, right? But still, in 10 years ago, if you want to go on the classic VC route, and I'm not sure you should do it, but let's assume you want to go on the classic VC route, there was basically one way to go, and that was to do what's called Israeli, right? Where you basically switch your company to a Delaware company and go to US, you move to US and you raise a big round over there. And that is not needed anymore, at least not from the money perspective, right? Mm-hmm. So you can say, what have happened? A lot of things have happened on both the investor side and the founding side. You have really ecosystems. So what is still lacking? The issue we're still having is that Europe is still 25 different markets. So what we're lacking is a big home market, and that is a big problem for any startup, right? Mm-hmm. So if you're US and you have been successful in Florida, I'm just saying one thing. How hard is it to scale to Carolina and Texas? Not that hard, right? You can use the same people, the same language, the same reference customer, whatever. Assume you are successful in Austria. How hard is it to scale from Austria to Denmark? Actually, relatively hard.
Absolutely.
It's just like, so to wrap up, what do we have? We have now serial entrepreneurs who've done it before. We have investors that have done it before. We have a multiple of them. So we have a lot going for us, I think. The fact that we are not one market, and there are many good reasons for that, and maybe we should not be one market, but it's from a scaling perspective, it is just harder to make a massive big company in Europe.
I agree with that. I mean, going back to the 90s, I did my first attempt towards entrepreneurship in the 90s while I was studying. It was an internet company. It was sort of, I would say, predecessor of Facebook, something in the single space connecting people, social media space. And in those days, the internet was young, so I only knew the Styrian, the Austrian ecosystem. And when I asked the question, I mean, would you give us money to invest in a company that's doing something on the internet? The answer was, I need a website. Why should I give you money for something else? So you can build a website, but that's that. And it has really evolved since then. What I got from your Vita, you made your career mostly in the internet technology sector. Is that right? In the startup scene?
I think, long story short, I came from, you can say, deep tech. I worked in pharma and biotech before. And of course, you can say, why didn't I become a serial investor in that space? And that is simply a hard space to be as a private investor, because the money is just need to pay, right? That means that if you're a business angel and you work in the next pharma project, whatever, how far can you get from your 100,000 euro? Not that far. Meaning that in the next round, when they need 5 million euro, you'll be diluted because you can't co-invest, right? And the length is very long, right? So when would you get an exit there? Mm-hmm. So the reason why I came mainly and focusing on my main thing, you can say, is B2B software. Mm-hmm. And that's because it's something I understand and it's scalable, right? So I also do other stuff. I'm also involved in, I'm involved in, I actually took one here. I'm also involved in this. I'm the co-founder of this, a sperm quality test kit, right? So that is great. A home test device for, don't worry, it's not used. It's a home test for sperm quality, right? this has in many ways more purpose. But what is the issue becoming a business in that area? That is that physical things, value chain, distribution, logistics, whatever, is just harder to scale. We can talk about the pros and cons of that. So, but one of the reasons why I focused a lot on software initially is it's, as a private investor, it's simply the easiest thing, I think, where your 100,000 euro will make sense. Where anything like I'm involved in oh, 1 second.
Sure.
Boom, 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 boom. It's not even here. Maybe also involved some crazy other hardware things which I can't really find. A thinking hat, consumer electronics, right?
Yeah.
Could you imagine doing stuff like this as a startup? Oh my God, right? You know. So long story short, I did that, but I always have a heart also for stuff that in many cases do more money, right? So when these entrepreneurs came to me, it's actually 10 years ago, 11 years ago, and said, we have an idea for this. I became the co-founder with a little bit of money, but also a majority was work. And if you know couples that have a hard time getting pregnant, you know, to be able to go to say to a man, go down to a clinic and get tested, it's not really sexy, right? So I thought, hey, could we do something like this? So I'm also involved in non-IT projects like this. I'm also a board member and investor in immuno-oncology startup, aka cancer vaccine, which of course also have a monetary perspective. Of course, it can be financially interesting. Of course, it will. But there's also many, an all internal agenda when we said what we want to do. We want to cure cancer. We want that the CTO got the Nobel Prize, and then we want to make money, right? So, it's. I think that's some of the benefits by working with life science is that it's. If you know anyone in among your friends and acquaintances who got cancer, right? Would there be anything more rewarding in life than would be taking part in launching a project that could cure cancer, right?
Absolutely agree.
So long story short, came from biotech, moved mostly into IT, but also involved in some life science projects.
Yeah. I did my first life science project back in 2006, and I quickly realized what you said. It was a spin out from Novartis, so I was lucky to get hired basically by the company. And it was Series A round was 40 million euros. So when I look at the European ecosystem and at the business angels, I think there are only a very, very few private people who can invest 40 million euros out of their own pockets into a company. And still, I mean, life science is always a very risky space. So especially in the early stages, the success probability of a single product is almost 0%. So there are very, very few people who are going into that space. That's why I always recommend when somebody wants to invest, become a founder and go on the executive board if you have expertise that's necessary to do so. Because then you can at least basically pre-finance your own expenses, your own salary, and make some money with the Series A, Series B, Series C if you know the investors. But now you are involved also in an immuno-oncology space. How would you define the difference between a life science company and an IT company?
I think the easiest way to explain it is to say, what is the risk? So the risk in an IT company is mainly on the market size. On market, right? Because you can always do it, right? If someone comes to me and said, Nicolaj, we want to build this B2B software, I have no doubt that in 99% of all cases, it can be done. It might be delayed, it might be more costly to develop, but you can build it. So what is the risk? The risk is there a market for this? Will people or businesses pay for that? Is it really better than the alternatives? Is it something? Yeah, all that, all the markets. Go-to-market, pricing, competition, all that. It's typically, if you take at least pharma, I'm not saying, so you can say medical device is a little bit in between, but if you take pure pharma, like the immuno-oncology space, I mean, there's no market risk, you can say. If we know we can develop this product that can improve life with a few years for this group, we sort of know already what the price would be, right? Because we know that, hey, governments are willing to pay that much for a year, therefore you can charge that much, and there are that many patients. And of course, there's always a risk that a new competitor come up, but actually that risk is not that big, because you know the funnel of all the big biotech companies where they are. So you say, well, in 8 years when we're on the market, here are the 5 most likely competitors. In other words, the market risk is not really there. What is the risk? Of course, the technical risk. If you have something that has cured cancer in mice, what is the chance that will come on the market? Less than 1%, right? So it's about technical risk, and then about the money needed to come to a point where you're de-risking the project. You can say, if you take IT, the typically amount you need to come to what's called product market fit, where you sort of shown you have business, for most will be a few million euro. And actually in the beginning it's less. So you spend 100,000 euro to build a prototype and get the pilot customers on. Then you get 1 million euro more to do a seed round, where you get more, and maybe 1 million more to do something else. And of course, after that, you can still scale if you want to be the global leader. But the money to de-risk a project is from 100,000 euro to a few million euro. The money to de-risk a biotech project, you can say, if you assume that is up to phase 2 data, will typically be 50 million euro. 10-15 million euro up to phase 1, and then a phase 2 that is 20 or 30 million, 50 million euro.
Per project. Per project,
right? Of course, you're not putting it in initially, but you can say, if you said from preclinical to phase 1, that is typically the 10 million euro-ish for phase 1, including all that. And if you need a portfolio approach to that, so you need to invest in 20, then you can say, if you should be a business angel there, you should have the 20 times the 10, that's 200 million euro, plus dry powder to co-invest. So that could be 200 million more. So you co-invest in the 2 or 3 that really takes off. So I would say, if you had 500 million euro, then I think you can make massive returns in this space. But I just take my wallet. I don't have 500 million euros. So
me neither.
So I think that's the biggest difference. So there's nothing in the world I would like more than, let's assume 10 years I made a shitload of money. What would I spend these 200, 400 million euro on? Would it be IT projects? Of course, some. But I would invest in 20 stuff like that. I think I would invest in something with cancer. I think I would invest a lot about CNS neurodiseases. I think that's big. Long lifetime extension in general, something like that. I think there's so much purpose. You can also, I just feel myself, when I talk about this, it has so much purpose.
Yeah. I mean, when I look at the stock market, I see that what you say in IT companies, it's relatively well planned. So of course there is a market risk. But usually the returns are more predictable than when I look, for example, SARS-CoV-2 right now, I mean, vaccine development, Moderna in this space, or German companies, it's more or less binary. Either it works or it doesn't work. So either the vaccine works on the market in patients, or it doesn't work. And in what you say, I mean, the 50 million euros up to phase 2 is right. But when I think a little bit further, I mean, when you're lucky, pharma picks it up. But every time when I start planning a biotech company, I go with, in my opinion, the worst case assumption. So let's just assume that we don't get a pharma company who picks up the data. So we also have to finance a phase 3 company, and then we have to finance the market entry. I always went with the ballpark figure of 1 billion euros, to say, which is needed to bring any therapeutics to the space, to the market. But recently in March, I was updated by some scientists to say, meanwhile, it's $2 billion.
But of course, you can say, if you have phase 1 data is typically risky in the world that there's so many out there. So you have to be lucky in the way that it has to fit exactly what the pharma is looking for, whatever. But I think if you come with significant, really good phase 2B data, and you can't get them funded or licensed out by pharma, I think there's something wrong. It has to be that the data is not as good as you think they are. Of course, you then have a strategic option to say, should I see if I can typically IPO this to get the funding, or should I raise private equity money to get it, or should I license them out? But I think with good phase 2 data, you always have the option, because pharma is also lacking this next thing. And the good thing about phase 2 data is that pharma has no problem spending 200 million euro on a phase 3. They have plenty of cash, but what they don't like is to invest in 100 different projects, because they simply can't get them integrated. But you can say a phase 2 with good phase 2B data, then you basically have a 50-50 shot of being on the market, more or less, in most indications. So you can say that is something that pharma like, and to take that. And then you have the option at that point in time to say, okay, but would I prefer to IPO instead? I can be in control. Do I prefer to take private equity so I have a more upside if, I have to live with the risk? Honestly, I don't think that is the situation that is the worst. I think the transition from preclinical to clinical, where someone has to test this in humans, and you have to convince typically VCs to test this in humans. I think that's also the situation we're in right now, where we have magnificent preclinical data, like really, 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 really good. And I've spent the last 10 years saying no to immuno-oncology projects because I didn't think they're good enough. And even when the one I'm in right now, where we have amazing data, that potentially there is a potential Nobel Prize in that, right? But it's still damn hard to raise the VC round.
I'm curious, what is this company? Can you?
So now we get the layman, right? I'm not a scientist. So long story short, 2.5 years ago, I met a scientist at Copenhagen University called Peter Holst. And Peter Holst is a former HIV researcher. It's actually a fun family background, because his dad is maybe the most rewarded scientist in Denmark. He invented the GLP-1 molecule that is now the cornerstone of diabetes treatment. So if you look into Novo Nordisk and see what they're making the money on, they're basically making money on projects based upon this molecule. And now his son, who's also a genius, he became also a scientist, and he didn't want to go into the same space as his dad, because that's really hard, right? So he said, what is the hardest thing for me to solve? And that was in the 90s, you can say HIV. So Peter started as an HIV researcher, and actually have an interesting project there, where we have some news coming out soon. We can't disclose them now. And then 8 years ago, he actually met a German scientist. And that German scientist said one thing to Peter, and that was, dear Peter, do you know that there are HIV similar parts in our genome? So if we analyzed your genome or my genome, we will find out that approximately 8% of our genome is not human. That is past infections of HIV, similar type of retroviruses we were infected with when we were monkeys. So long story short, monkeys were infected by HIV similar viruses. Fast forward 100,000 years, a few 100,000 years, we have these parts in our genome. And they are not causing damage normally. But cancer use these sequences to grow. So already 30 years ago, scientists found out that if you block those, it's really, really hard for cancer to grow. Long story short. Peter had a platform for HIV treatment. He then basically tailored this platform to these genes we have or these virus part we have on our genes, and find out that he could basically cure cancer in animals. Not only cure cancer, but get these animals to be immune to new types of cancer. So for instance, if we take a mouse and we give it breast cancer, we then cured for breast cancer with our vaccine. And then 3 months later, we try to give the same mice colon cancer. The mouse is immune to colon cancer.
Okay, really?
That's what we're trying to do. So we right now We'll be funded by the Novo Nordisk Foundation and some others. And you can say we're in that step where we're trying to get the X million euro to test it in humans.
So you got Novo Nordisk already as a partner on board.
Not a partner, it's a foundation. The Novo Nordisk company is owned by a foundation, like the GlaxoSmithKline Foundation, and the Novo Nordisk Foundation has invested in us.
But that's great news, because it's very helpful, very supportive to have the right partners on board early on.
Yeah, it's coming back to what are investors looking at? They're looking for credibility.
Yeah.
One way to get credibility is, what have you done in the past? In the IT space, I will ask you, so how many software customers do you have? You can't really do that when you are a biotech company. So I ask about the amazing data you have. I would ask you which famous professors would support you. And I would ask you about which credible investors have already put money into you. Mm-hmm. So
with that strategic partner, you definitely have that. Let's stay a little bit at the ecosystem part with your company. Did you start the company where you're a co-founder at the beginning?
Sorry, I'm not a co-founder of this biotech company.
Okay, so you came in a little bit later. When I think to the Austrian ecosystem, I mean, what you said at the beginning of our talk, Europe are 25 different territories. So I would completely agree to that. I mean, there is no united Europe. We have different cultures, we have different languages. And especially when I look at founding a company, the risk is very high. So there are almost no VCs in that space. The companies very often rely on public funding. But when I look on the public funding side, there are always funny discussions because, of course, local governments invest money into companies to grow the economy locally. But in our space, in the life science space, let's say when we talk about team building, about credibility, finding the right people on the team, most likely they are not in small countries. So we need to build an international team. How supportive is the system in Denmark when it comes to international questions and public funding?
That's a broad question, you could say. I think in general, we have, and I think it's actually easier, the higher up north you get in Europe, I think in general, there's more public support, not only for startups, but also in general, you can say, that's a welfare system with the pros and cons of that, right? So for sure, there is more public support programs in general in Northern Europe. And I think we have great support up here. But it's not that different from other countries. You can say in Denmark, we have Vækstfonden, the Danish Growth Fund. In Germany, they have the HCGF, the High Tech Grüner Fund. In Norway, they have Innovation Norway. You can say they're sort of pretty similar. They all try to solve this valley of death, right? That is in public funding, with funding where you quickly need a lot of cash, but you haven't proven yourself. So it is, I think, what economists would call the net externality here, right? So for me as a private investor, it doesn't make sense to invest because the risk is so high and I don't get all the benefits, but society get all the benefits because if I invest in you as a scientist, even if our company fails, we still have generated some new knowledge, so you go out and create a new company and generate knowledge. I think that's the overall thesis. I think we have massive support here in Scandinavia. And of course, that really is helpful in the first stages, right? Where you need the 1, 2, 3 million euro. I think the issue is that when you need the 10 million euro, then you typically need private funding, right? Of course, what we're having now, and that's quite interesting, is the EU with the SME instrument application that is now called Accelerator, where they are both now, in the past, they only could give 2.5 million euro in grant, and they are now moving into also basically the VC space, you can say. It's still brand new. I think that would be interesting. I think the main issue here is that, as you said, there are a limited number of VCs in each country. And for a VC fund that is maybe 100 million euro, they shouldn't put in 15 million euro in one because they need to have a portfolio approach. Yeah. So that would mean even for a modest round like ours, 15 million euro, we will be looking for 3 different funds. And that would then mean that we will need ideally one local fund who can say, hey, these guys are smart and they're local. And then we need to syndicate with 2 funds typically in Europe, because it's still local in that way. And that's just make it even harder, right? Because you're not trying to convince only one investor. You're trying to convince 3, and 2 of them are maybe located in France and Spain. And now with Corona, we cannot even visit them. So how do I convince a fund in country X to give us 5 million euro when, of course, we can meet, but it's not that easy, right? So there is local support. I think the EU has moved in. It's really interesting to see how they would navigate in this space. I think we'll see, especially in the life science, that the governments will move more and more in to do this, because it's simply, the checks are so big that it's really hard for private people to invest.
Yeah, that's true. Especially, I mean, all over Europe, we have very high tax rates. So there is not much money left on the private side. Let's walk through the value chain a little bit and look at the pros and cons of the European system. I think when we look at the technology, thanks to the Horizon programs of the European Union, we have an abundance of technology. When I look on the financing side, while you were talking, I was a little bit smiling because it reminds me of a speech I had with an IT investor years ago, where I complained that there is almost no money on the European market for life science projects. He said that's not true. We have enough money. Maybe the projects are not good enough. But I think the reality still is it became better. There are more funds right now. So once a company reached the preclinical space, we can select from funds, but there are not a lot out there. When you look at Austria, still there is, let's say, no local VC fund with, let's say, a bigger capability of investing money, like several 100 million euros. That brings us to the point that we need to build syndicates all over Europe. And what's your feeling? Do we have sufficient funds already in Europe so that it's absolutely no problem, or is there still some room for improvement?
I can give you the real figures, right? Because we mapped it. So we done it the last year, right? Yeah. So if you take an early stage pharma project like us that is raising an A round, right? So raising, let's say, 10 million euro globally, funds that would invest in an early stage European pharma startup doing this is around 120, and we're sort of talking with all of them. So around between 100 and 200. And many of them
number of funds.
Number of funds, right?
Mm-hmm. Okay.
Number of funds. Many of them in real life are not interested in doing something in Europe unless it's very specific cases, unless it's, if you get an American VC fund to invest in your Series A in Europe, it's typically because they know you already, you worked with them in the past, something like that. So let's cut them away. So what do we have in Europe for this? We will have like 30, 40 funds in Europe doing this. Maybe 30, 40, 50. Let's say we're really, really optimistic now. We say there's actually 50 funds. Some of them are actually quite small, but that's 50 funds. That is the total sum of potential investors. And you need to convince 3 or 4 of them. So you need to have a hit rate of 10% of all available funds to succeed with your syndicate. If you talk about any other sales process, if I said to you, Christian, go out and you're focusing on this segment, let's talk when you have 10% of your potential customers on board, you will say, it's never going to happen. 10% early days. So I think, and then you have the 40 funds, you can say, and you need 10 of them. Some of them might say, hey, we are not investing in your space right now. We are not doing immuno-oncology. We are only focusing on gut health, or we are only focusing on CNS, or we actually prefer medical device instead of whatever. Okay, then you have 20 left. So we have 20 funds who really want to do early stage immuno-oncology. 25. Okay, some of them might have invested in other projects already. So they said, hey, Nicolaj, we have 20 spots in a portfolio, we already have 2 immuno-oncology there, so we overrepresented. So despite we like your data, we can't take 3 or 4 immuno-oncology into 20 because we need to diversify. Okay, so now we go from 25 to 10 to 15. So we have 15 funds, and you need 3 or 4 of those. And you ideally need a local one, because if you don't get the local one, for you, that will then be Germany or Switzerland.
Which is tricky in Austria.
Yeah, so you have to go out there, and you have to convince one German one, because the German one is perceived by the Danish one to be local. So it's just a numbers game that is, And then of course, of the 40 funds, now it's going to really want, are they in the investment period or not? Because they actually only invest in the first 3 or 4 years, and then they harvest after, you can say. And especially the earlier project you have, they will only invest in you the first 1 or 2 years, because they need enough time to sell before. So in real life, it's tricky. If this, offline, Christian, I can show you the list of all the funds we've been talking to, and that's basically the list, right? That is the list of funds. It's not like, of course, then we can be lucky. Then in Denmark, we have one of the veterans in this space, Christian Christoph, who basically just launched a new fund a month ago, which is great, because actually one fund has a significant impact. So is there enough funds? And no. What is solution? I really don't know, because when governments play VC funds, is that the right solution? Neither, not always, right? But I think there is a massive need.
I see the same need on the market and the same opportunity. I don't know if the figures are still right in 2020. I did a little bit of research in 2019. And I've put together some published reports from basically Ernst & Young, KPMG, Deloitte, and just got ballpark figures. So I didn't dig into it very deeply, but from what I got, top level is that every year about $20 billion are invested in life science in the United States. So similar number in China. And we have 3 to 5 in Europe, so that go into the life science space. And one friend from China laughed and said, and half of it happens in the United Kingdom. So for continental Europe, it's, let's say, 1 to 3 billion maximum per year. But we have a lot of technology thanks to the Horizon funds. So I completely can agree to what you say, that it's very tricky to raise money in Europe only. And you earlier mentioned that a solution might be an IPO with a company, and there are several options. But do you really see that happen in Europe? That there is a space for IPO?
It's very country specific, you can say. And you take 2 countries that from the outside can look very similar, like Denmark and Sweden. And from an IPO perspective, at least in the life science, they're not. So if you take Denmark, actually you can IPO in a tech company, because this is a tech company which I co-founded, and we IPO'd that in June. That you can do. But the public capital market in Denmark for small companies is still very limited. But if, for instance, in Sweden, they have a local stock exchange for small companies, and that has a large number of biotech companies, actually. So if you're going to raise maybe not the 15 million, but the 5 million euro funding for a small phase 1 or whatever, that is actually possible to do in Sweden. So we have a number of Danish biotech companies that have semi-relocated to Sweden, at least put some of their office down there, and then are raising on the Swedish stock exchange. But it's very country specific. I think also in UK they have this AM stock exchange that is also for small companies. I don't know how many biotech companies that are there, but no, it's not the normal route.
Let's explain a little bit my IPO picture that I have in mind. So when I look over the lifetime of a life science company, I think initially in Austria, 1 to 3 million mostly comes from public funds. We have a very generous public funding scene, thank God, and thank the government. Afterwards, we need the Series A. So it's what you say, 10, 15, 20 million euros, which can be done in Europe. But I always wanted to avoid any going public discussion because I think it's just complicated. So when I have a company with a Series A, I can raise it privately, and I spare myself a lot of pain on the stock market because I have different reporting rules. When I go further down the road, Series P, I mean, you mentioned that we need 50 million euros per project to come to a point where we can sell it to big pharma. Ideally, when I would like to IPO a company, ideally the company has a pipeline. So with, let's say, a front runner, which is partnered already with pharma, then we have a second program, which is very well in the clinics, some preclinical projects, and a discovery pipeline. So this would be my ideal world. Yeah. But when I take what you say and I sum it up in my mind, I come to an IPO, like HOOKIPA Pharma from Austria did 100, 200, 300 million euros. Do you really see that coming in Europe so that we have enough potential here on the market?
I think you should ask yourself on, well, this is really, these assets are really suited for it, right? Because the risk is still so high and it's often binary. And one of the issues going public also with a life science company is that it limits your exit opportunity, right? Because the normal exit opportunity will be that you raise for the phase 1 and 2, and then you partner up and sell to big pharma. And maybe these startups are asset specific and shouldn't build a real startup, because actually they deliver an asset that should be sold to pharma. The problem is that if you go public, it's much harder for a company to be acquired, much harder. So you can say if a big pharma is looking at your private company and you have phase P, they is basically negotiating with you and 3 VCs, what should be the price? Okay, we take this, you get an earn-out and bonus and milestones or whatever, that's fine. But do a takeover of a public company, it's really, really hard. And that's not something you do for a deal for 100, 200, 300 million euro, whatever. So I think, I'm not sure how many of early stage life science companies that are really suited for private markets or for going public, because it's only if you can see you can actually build a viable biotech company out of that. And of course, all founders have that dream, but I think to be realistic, many of these assets are better suited for continuous development within pharma. So I fully understand why some biotech companies are considering that, and of course it's also something we consider, but it's really country specific. We would have to do it in Sweden, where there is a larger appetite for this kind, and I think at least I think we have 2 or 3 Danish immuno-oncology projects that are currently listed on the Swedish stock exchange.
I see it the same way. I mean, when I heard once the term one-trick pony. So when I see a company with one asset that has not proven something in clinics, I would also stay away from the stock market and just leave it private, because this is then the typical company that is just bought by big pharma, and the team gets an exit, stays on board as a consultant, and that's the end of the story. When I look for companies that really have platform potential and a massive pipeline, this would, in my opinion, be, when we look at the therapeutic space, this would be the perfect company for raising bigger money. So it's not being acquired by a pharma company anymore. It's more licensing single projects and fueling the pipeline. But as a European, I would really like to consider IPOs on the European market, but is there enough money on this market so that we later on, when we look at the public space, that really can confidently say, okay, raising 2, 3, 4, 500 million dollars or euros on the European market is possible? Do you see that?
Yes, I think the money is there if you come to that point, but there's simply not that many biotechs that are coming to that point.
Yeah.
So I think that's not the bottleneck. The bottleneck is it not raising 200 or 300 million, because at that point in time, that is because you have phase 2 data.
Yeah.
I think the bottleneck is, how do we get the phase 1 and the phase 2 finance, because that will you need a lot of investors who are putting in these 10 and 20. So actually also the sum will be very large. And then we're coming back to the 40 VC funds or 100 VC funds, or how we count it, who who can do this. So I think it's like the chicken and the egg. You can say, why are there not that many late stage assets in Europe with this massive pipeline? And that's of course because you could of course blame the number of VCs, but it's actually not only that, because it's also the step before. And the step before is we have really, really good science at university level.
Mm-hmm.
And to take that out and build startups does not only require financial capital, also human capital. And many of these scientists are not interested in that. Many of those want to write articles about it and dream about a science and nature article. They don't dream about building a company. And that's actually also one of the reasons why I ended up in Biotech, the immuno-oncology company, which I'm part of right now. That is because one of my first questions to Peter was saying, if we can raise the seed money, which we then did from the Nordic Foundation, would you quit your university professor's position and become CEO? And that's a massive, I don't think we as non-academics cannot fully understand how big a step that is. I'm not saying you're burning your bridges, but you're going out of everything you've done the last 20 years. Mm-hmm. And that he did. And without a person like him to go out and actually build it, you cannot just take the patent, right? So when we talk about the ecosystem in Europe, we cannot only focus about what happens about funding phase one and the seed funding, so seed and Series A. We also need to focusing on how we can get more academics to build startups. And that's actually why the Novo Nordisk Foundation, which funded us, actually created such an initiative called the Bio-Innovation Institute, so the Novo BII. And of course, they're coming with seed funding to companies like Biotech with Peter and I, but they're also doing a massive task of actually giving smaller amounts of money to these researchers to go out and prove themselves. And I think that is even more needed, right? Because that is the food chain for building successful startups.
Yeah, absolutely. That's a very important point that you're making, this, which is very often forgotten, this switch in mindset. Working on the university level is something completely different than working in a company. So I would phrase it in that way, that doing research on a university is, in my opinion, or research organization, it's more on the creative side of life. Researchers can do a lot of projects. They can focus on gaining expertise and experience. And the endpoints are publications mostly, and lately also patents. But once they switch into a company, it's a development story. So a company focuses mostly on one goal. It's important to focus the resources on this goal, not looking left or right. Publications are nice to have, not so important. And it comes more on the patent side and development side. What was your experience with your company? How the scientists managed that switch?
I'm actually extremely impressed about him, because I tried to warn him a little bit. And the good thing was he already had done other projects that was sort of semi-spinned out in real companies. So it was not the first time he got seed funding or whatever, but he still continued as a scientist. And he basically said, this time I want to do it real. And I'm so impressed, because what is he spending his time on now? Managing people, getting funding, stuff like that. And I think it comes from his burning desire to actually do it, right? And he wants to set his footprint. And it's not about money. It's about not only showing in animals that this technology can cure cancer, but that it actually can do it in humans, right? Because that's where you make a difference, right? But he managed extremely well. It's been because it's really I actually say it's really, really hard to be a full-time academic, because they also have to fight for resources, but it's another system. You don't have to be that extrovert in standing in a presentation for VCs and stuff like that. I think Peter has done it extremely well. And it's something, this journey we've been on, we've now been on this journey for, I think I met him 2.5 years ago. And it's been amazing. And I also like being with now I've spent a number of years mainly with software, and also really, really skilled professors in software encryption and stuff like that. But it's just also fun for me to meet now professors within immune oncology and learn so much about that. So I enjoy it, and I think we need more people like Peter that is taking that jump out. Of course, they shouldn't do it just every time they have a good idea. But when you come to a point where you think, hey, we can't really do much more in the academic space because we need to raise significant amount of funding, and for that we need also persons to do the real life job. We need persons like him that is quitting their academic career.
And I think we also need more people who support scientists and who are not scared of science. I also agree it's the best thing in the world to work with the smartest people to solve the world's biggest problems, because this is really something nice that we have in our industry that you mentioned at the beginning. I mean, just imagine you can cure cancer. So you work with the right people who move projects forward, bring it to the patient, and really change lives to the better. I'm pretty sure you presented yourself, or I presented yourself as a business angel and investor. So it might be that some people from the life science community, especially young entrepreneurs, might reach out to you and ask you for advice and if you want to come on board as an investor. Let me ask you one question. When they reach out to you, what is important to you to see in the pitch deck? What should they present to you?
I would say it more broadly than the pitch deck, because what is an early stage investment really about? I think that's about trust, right? So you should go one step back and say, when I contact this person, that could be me or it could be whatever VC or something like that, how can I gain that trust? Of course, if you know the person already, that's a great way, because then hey, Nicolaj, remember we worked together 8 years ago and I have this project. Okay, then I trust the person. But it can also be helped indirectly. And that's why VCs and also angels really like these introductions, because there you have another person saying, hey, this person really has an interesting project. So for instance, the reason why I ended up in Inpoter was because one of my co-investors, who is in the biotech industry, he actually had been asked by Peter's team to join the board. And then when this guy Lars saw the project, he said, it's really interesting, but I don't have time for that because he's running his own full-time job. You should talk to Nicolaj. So that kind of introduction is really helpful. Of course, it can also be counterproductive, because the best scientists in the world might not have a direct connection to you. So what can you do? You can build trust in other ways, and that trust can be, what have you doing now? So if two persons come and say to Nicolaj, we can cure cancer, and one of them is a professor at University X, and the other one is just I don't know, a random guy or girl doing something on the kitchen shelf. I don't really believe that person. If you are a person that don't have these credentials, like being a professor within this space, now we're talking about life science, of course, you need to team up with people that have that, because the investor most likely cannot judge that. I don't have the background. I cannot judge Peter's science. But when the person who introduced me to that was basically also another board member, is also a founder of a listed Danish biotech company, that gives you that trust. So pitch deck is not really much about this hockey stick out there, because we all know that it's fake. It's about who do you are and why should I trust you. That is about what have you done in the past, who are vouching for you, both as investors or co-investors, and also who have you built on your team, right? Because that's basically your first investors, you can say, that are your co-founders. So ideally you say, hey, I'm this science geek, which is meant extremely positive, by the way, and I have teamed up maybe with another science geek. Okay, maybe you'll team up with someone else also. That could be a person with a more commercial background in the industry. I think something like that. You need to build your personal trust. I think that is it. So don't get too caught in, well, this slide is ugly or whatever. I can promise you that the slide deck from Inpoter was extremely ugly, and I didn't understand any single thing about that. But the only thing I understand is Peter seemed to be an interesting person, and persons who were able to judge his science said he was onto something.
Mm-hmm.
I think that's a starting point. And then you have to build trust directly by meeting the person, etc., etc.
No, that's absolutely important. The two things that I got out from what you said is build a team and build trust, which means build relationships with investors. It's not a transactional system like buying a car. So that you just go to the car dealer, buy the car, and that's it. It's a long-term relationship that I hear very often. It resembles very often in the talks I have. I read that 75% of startups fail. Do you think building trust with investors and relationships is enough, or are there other pitfalls that you experienced lead to failure of the 75%? What should startups do to become one of the 25% that succeed?
I think it's very different which industry you're in. I think if you're talking about industry where you mainly have market risk, then it's about de-risking that. And the only way to do it is to get customers on board. Customers, if it's B2B, if it's B2C, most likely users, because none of us are paying for the apps. So the one thing you can do there is as quickly, as cheap as possible to validate that someone is really want to buy it, right? So that is the lean startup movement, all that. That is for the low tech thing. That is, I think, that's one thing. Or they say two things. Build a team with different skills. So that's technical and business skills, and go out and validate the need. For life science, at least therapeutics, it's not really about validating the need within consumers, you can say. Maybe you should validate the potential need with partners like pharma companies or whatever. Of course, not from day one. But there, you have to realize the majority of the early funding most likely is coming from the public sources, right? Because they have all these externalities, so it makes sense for them. So you'll have to look at yourself as private investors and think, do I think this is fundable from a public point of view? Would the public, not only would I trust Peter, but would the public trust Peter? And that is about the team you're building. And if you're doing that, then try to build a team not only with other scientists like yourself, but also with key opinion leaders that the public can trust. So for instance, when I met Peter, he said, by the way, Nicolaj, do you know NCI, National Cancer Institute in the US? Well, most know. Jay Pesovsky, who is basically the head of the vaccine department there. He's my advisor. He's a public employee. We're not allowed to pay him. Okay, can you see how much trust that gave? That a guy like him, who is really well known in this space, he wants to be advisor without being paid, right? So I think if I was in therapeutics area, it's about building that trust on the science side. So you can say software, validate need, build team. Therapeutics, of course, you should generate data, but you also need to generate a team that you can trust.
Nicolaj, I could speak endlessly with you. It's very interesting to learn from your experience. I really love to talk, but I also know that you have a full schedule ahead of you. You have a lot of work on the table. Many thanks for joining this podcast recording, and it would be great to stay in touch.
Thank you. Have a nice day.
Have a great day. Bye-bye.
Bye.
Thanks for listening. Please share the podcast and make sure you've subscribed. Have a great day.